Now, the Northwest Health Department will take action against nurses at the Mahikeng Hospital who placed newborn babies in boxes rather than incubators. 9 babies were placed in cardboard boxes at the provincial hospital due to a lack of cribs. And to discuss this further, I'm joined by Progressive Health Forum's Dr. Monica Springfield. Thank you so much, Dr. Springfield, for your time. Just your reaction, and particularly from the nursing staff's point of view, what ought they have done in the absence of adequate cribs and incubators? Good morning.
Good morning. Thank you for having me. Well, I have empathy for the parents and I apologize for the distress. And I understand that the nation is shocked. It's always an emotive issue when the care of babies and children are involved. However, there are bigger issues at play here. If there were 58 unexpected babies, then there was probably a 16% increase in mothers needing to deliver. And I'm sure they did not have the best of experiences. So, just this weekend, there were 25 mental health care patients permanently in an ED department in a big Joburg hospital, and 6 ventilated patients waiting to be admitted into ICU. And there's staff shortages, long waiting lists, and burnt out staff. So, yeah, we should, have more shock and horror at the state of healthcare in South Africa.
You mentioned a number of systemic... Yeah, I beg your pardon. You've mentioned a number of systemic problems, not only human capital, the fatigue of the medical personnel, and also the lack of adequate infrastructure, the beds, the overcrowding in the hospitals. And there doesn't seem to be a clear plan in sight. Dr. Springfield, your view?
Yeah, it doesn't seem to be a clear plan. We seem to be reeling from crisis to crisis. It doesn't help that we've had sort of over 9 or 10 MECs in health in Gauteng in the last 10 years, and just as many Department of Health. So, yep, we are in a healthcare crisis. And events like this doesn't happen in isolation. It's a systemic problem, and certainly we need to get a grip with what's happening, stop with investigations. We are over-investigated, stop with commissions. We know what the problem is. It's just to sit down, get adequate leaders in who are passionate and want to make a difference, and get the ball rolling. There are enough people out there who know what to do. And just, for these people to be contacted and systems to be put in place will make the difference.
Now, with the health workers, the union obviously will make a case in protecting their interests, ensuring that there isn't any harsh penalty. But should they be penalized, especially if they only reacted to a situation or trying to circumvent or, a potentially even dire situation?
Yeah, like I said, events like this doesn't happen in isolation. It is a system at fault. Why would anybody want to put a newborn baby in a box if there are workable alternatives? Staff on the coalface are on their own doing the best they can. It's always very sexy to name, blame, and shame. That's the first thing poor leaders do when there is a crisis or when there's an adverse event like this. And then there's an investigation and people get suspended and everyone's satisfied that the best was done. We have had many CEOs put on suspension, and this is not the first time we have babies in boxes. In 2007, a very good CEO at Baragwanath Hospital was suspended and moved out of Baragwanath Hospital for babies in boxes because the whole system was overwhelmed. In 2012, Thuli Badonsela was asked to investigate the issue of over 155 babies being put in boxes in other hospitals. So this is not the first time that this is happening. And, people get suspended, they get moved away, they come back, or worse still, they sit around for a year or two waiting for their cases to be heard. So, it's not about blaming, naming and shaming. It's just about sorting out the system.
Yeah, so besides the system, as you're saying, now we have a human element as well, where the blame is now being focused on the nurses, and unfairly so from what I read you're saying. In the interim, do you think that there is just a lack of compassion. There's just, there used to be a saying, the Batupili principle, which premised government service delivery to give dignity and care and love, particularly for healthcare services. Do you think that there's a level of compassion that is missing in how we interact with those that need these services?
I don't think so. If a system is overwhelmed, if you are burnt out and exhausted, if there's no one that is able to listen and make a difference, if your leaders and if your managers are incapacitated and the leaders are just not there, I can tell you that those nurses or the clinicians themselves are not getting love and care and attention and thanks. Okay, so it is very difficult if you are burnt out to be able to extend that to someone else. That being said, nurses and clinicians and non-nursing staff in hospitals are completely at the end of the tether. They are overwhelmed. They don't know what to touch and what to leave, or who to help or who not to help. So it's not about people sitting in the corner and reading newspapers, or doctors lying in their sleepover rooms not responding to calls. Everyone's on the coalface and everyone is working to full capacity, in fact, to above the capacity. So it's not about lack of compassion. Nobody goes to work wanting to be cruel to someone or goes into medicine wanting not to be compassionate.
All right, Dr. Springfield, we're going to leave it there. Really appreciate your time this morning. From the Progressive Health Forum, Dr. Monica Springfield reacting to the story in the Northwest, in Mahikeng Hospital, to be specific, where 9 babies had to be put in empty cardboard boxes because of the lack of infrastructure, necessary cribs and incubators.